Lacking of HIV education is a significant issue in Kenya. Though Kenya is experiencing a recovering economy, according to the data collected from CIA, 43.4% of the population is below the poverty line. Kenya struggles to provide access to basic healthcare services and medical treatment to its citizens. According to the World Health Organization, only 4.6% of the nation's GDP was invested in the health sector. Based on the data from the CIA, the degree of risk of getting infectious disease is high, and the leading disease is water contact disease like diarrhea. More importantly, another epidemic disease is HIV. It turns out that more than 1.6 million people are infected by HIV in Kenya, and HIV is the fifth leading cause of death in Kenya. Generally, the lack of HIV education and infrastructure are the primary issues we are facing in Kenya. In this case, the most effective way for Kenya Progress to improve the current situation is to offer general health education, especially for women and children in local community. Especially, this general health education will include what is HIV, how is HIV transmitted, how to reduce the risk of getting HIV, how to protect themselves. Additionally, general concept on family planning will be included as an important idea, since sexual transmission is the major transmission way of HIV. The budget and progress of the activity on HIV education will be tracked weekly as our feedback to improve the quality of the project.
Today, Kenya's agriculture still plays as the most important factor, which contributes around 25% of GDP, which is $500 million in 2013. Kenya agricultural products include domestic animals, vegetables, wheat, tea, corn, flour, and coffee. About 75% of population in Kenya work in the farming sector. The population growth rate is currently around 4.4%, which means by 2050 the population will double from 40 million to 80 million. The government is still struggling to feed the population, but 2/3 of Kenya land have never been farmed because there is no rainfall. There is not going to be room for large-scale farming on arable lands due to population growth. That has led to the most of the land being taken over by home construction. Plants that are not traditional growing climate will be possible to grow using controlled environment systems like hydroponics. We will invest about 200 million to establish an intensive farm, producing high-quality products for both the national and international market. We are going to train our skilled staff in the hydroponics. We are providing work and leadership experience for local women. The company will sync contact with local and international companies in order to learn about vegetables that grow faster in our local place.
According to the EFA Global Monitoring Report in 2009, over 50% of teenage women are not enrolled in secondary education, resulting in a large gender gap in actual adult literacy, which is 16% of women lacking literacy as compared to 9% of men. This implies a failure in female retention rate at the secondary education level and is a contributing factor in slowing the progress in women's fight for equality. The lack of economic support is preventing women from continuing their education and therefore barring them from success. This lack of literacy among women prevents them from finding professional jobs outside of the household. They also lack any federal support. Only 29% of Kenya's workforce comprises of women, and they only generate a fraction of the income when compared to their male counterparts. These fundamental differences between education and labor between men and women lead most households into extreme poverty due to the woman's substantial role in her household and her disproportionately low income. How can we combat the issue of women dropping out of school? With our budget, we will provide women who exhibit academic and professional potential with scholarships to help them stay in school. We hope to help women further their education and engender an increase in their overall literacy rate in the coming years. Another aspect of gender inequality involves the healthcare sector, which was previously touched upon. HIV infection rates among women is exponentially higher than in men, according to the Foundation for Sustainable Development, and women are left to die from AIDS when their home is taken from their husband's family. Access to healthcare is disproportionate among the two genders, with women naturally receiving less medical attention than males due to their life of poverty. Kenyan Progress will establish clinics of trained medical professionals and volunteer assistants dedicated to treating impoverished women in need of urgent health care. This will ensure that abandoned women affected with HIV will have some place that they can look to for help instead of accepting their imminent death.
As you can see, Kenyan Progress hopes to bring the catalyst to stimulate this country's development. There are many specific goals that our mission statement entails. However, our top 3 priorities include boosting the agriculture, improving access to healthcare, and empowering women to bring gender equality closer in the region.